Gravity of the complications. The local inflammation, which is all that most patients see in a gonorrhea, is actually the least of its dangers. Apart from the danger of conjunctival infection, which is common to both sexes but rare in the adult, the complications due to direct extension of the disease are different in the two sexes. In man, the complications are almost entirely under the control of the skillful physician with a faithful patient. But both are rare, and patients in the poorer classes have neither the means nor the leisure to avail themselves of the resources of medicine. Among our dispensary patients, the greater number suffer the pangs of an acute posterior urethritis, and some 10% to 20% suffer acute epididymitis, which in perhaps 1/4 of these is bilateral and results in sterility. Chronic urethritis or prostatitis results in fully 70% or 80% of these cases, and severe urethral stricture in a small percentage. Sexual neurasthenia follows gonorrhea in 5% to 10% of clinic cases. Among our wealthy patients who are well treated from the onset of their disease, epididymitis complicates less than 5%, chronic urethritis and prostatitis less than 20%, and stricture is altogether exceptional. But even the wealthiest patient may not be willing or able to command good treatment at the onset of his gonorrhea, so that more than half the patients treated in the office of the specialist suffer from chronic gonorrhea. Such complications as prostatic and periurethral abscess and pyelonephritis are rare in the clinic, extremely rare in private practice. In women, on the other hand, grave complications are common. Invasion of the uterus, the uterine adnexa, and the peritoneum were noted in 40% of the women reported to the Committee of 7. Gonorrhea reaches the uterus in 20%, the tubes in 5% of cases, says Schmidt. This invasion of the female generative organs takes place either at the time of infection or after the birth of the first child. For the gonorrhea may subside and become latent in the glands of the uterine cervix until pregnancy excites a congestion that increases the virulence of the gonococci. By these, the child's eyes are endangered at birth, its mother's uterus and tubes immediately thereafter. Gonorrhea of the uterus and tubes usually, though not always, implies sterility. Footnote: Moskowitz has reported a tubal pregnancy coexisting with pyosalpinx. Hence, this sterility is total if the wife's tubes or uterus are promptly infected. It is the so-called one-child sterility if they are infected at the time of parturition. Neisser and Bum agree that the gonococcus causes about 30% of sterility in women, while Morrow states it is responsible for fully half of involuntary sterility. But besides depriving a woman of her children, gonorrhea may render her a permanent invalid, may even cost her her life. It is a curious fact that gonorrhea in women is either much milder or much more severe than the disease in man. Some women are so little inconvenienced by it that they do not feel the need of summoning a physician. Others are overwhelmed by acute salpingitis, pelvic abscess, peritonitis even. They must either undergo a capital operation or die. Still another class suffer relatively less from the tubal or uterine complications at first. They are not mortally ill, but they are up one day and down the next, semi-invalids all the time, with scarce a hope of release, unless it be by oophorectomy, a capital operation, implying loss of the faint remaining hope of children and perhaps a continued invalidism thereafter. Compared with these major evils, the danger of infection of the eyes by the fingers or to the rectum by drips of vaginal secretion is nothing. Children are doubly endangered by gonorrhea. In the first place, their eyes are in imminent danger of inoculation at the moment of parturition. From such inoculation is said to result more than 1/3 of congenital blindness. In the second place, the infant or the young child remains peculiarly susceptible to gonorrheal infection. Its eyes or its genitals may be the portal. Gonorrheal conjunctivitis and urethritis in the male present no very peculiar characteristics in the infant, But gonorrheal vulvovaginitis in little girls has a horror all its own. The quite inexplicable readiness of infection, the rebelliousness to treatment, the grave and lifelong complications make it seem one of the cruelest of known maladies. The last count in the indictment of gonorrhea is systemic gonorrhea, often spoken of as gonorrheal septicemia or gonorrheal rheumatism. Systemic gonorrhea is very grave, quite rare, and fairly controllable. It is grave in that it causes iritis, endocarditis, a very chronic type of chronic rheumatism, and many other lesions. It is fortunately rare, its frequency being estimated at about 1% of cases. Cole and Hetch say 0.7%. Ward says 1.2%. Of its control, there is no absolute certainty. The disease in most instances progresses slowly to spontaneous cure. The horrors of gonorrheal rheumatism are more talked about than they deserve. Only 20 of the 5,782 gonorrheics in the Army were permanently incapacitated by it.